Hello everyone, I'm Dr. Pritam, your own physio advisor. This particular series we have started for our budding physios, the final year students and the interns. Today's topic of discussion is medical diagnosis versus physiotherapy diagnosis. How physiotherapy diagnosis is different from medical diagnosis. Let's start with medical diagnosis. So medical diagnosis basically focuses on the disease or pathology. A medical diagnosis identifies the underlying disease or medical condition based on investigations like X-rays, MRIs and other lab findings. Let's understand this with a very simple example. A patient with knee pain might be diagnosed by a medical doctor as having osteoarthritis of knee joint. This tells us what the disease is, but not necessarily how it affects the patient's functions. On the other hand, if you look into the physiotherapy diagnosis, it basically focuses on the functional impairments. A physiotherapy diagnosis focuses on how the condition affects movement, posture, and even the activities of daily life. Using the same example of knee osteoarthritis, a physiotherapist might diagnose the same patient as having reduced quadricep strength, altered gait pattern, maybe patellar maltracking, limited knee flexions, or even it can be impaired stair climbing ability. So as a physiotherapist, we go beyond the level or tag of the disease to understand why the patient has pain, which structures are dysfunctional and what needs to be corrected so that we can restore the optimal movement of the patient. So here we can put this in this way. These are two different approaches having the same goal. Medical diagnosis is about the pathology, whereas physiotherapy diagnosis is about the dysfunction. While medical doctors focuses on managing the disease through medicines, surgery or other interventions, physiotherapists focus on restoring function, improving movement and reducing disability. So as a physiotherapist, we evaluate muscle imbalances, we evaluate joint restrictions, postural deviations, movement patterns or even functional limitations. Now one question might arise, why this is important for patients? Why we need to differentiate these two things? It is because two patients with the same medical diagnosis might have very different physiotherapy needs. One may need strengthening, another may need motor retraining, a third may need postural corrections and gait training. So here you can say physiotherapy diagnosis basically helps us to personalize the treatment plan for the patients. So in conclusion, we can say that both medical diagnosis and physiotherapy diagnosis are essential and they even complement each other. Together, they help ensure better outcomes and faster recovery for the patient. Thank you.